99% of the people that get this recover, and most of those never even knew they had it. My name is Dan Orr. I live in Las Vegas, and I'm certified in 3 different specialties. One is my primary one of oral and maxillofacial surgery. I'm also boarded in anesthesiology and legal medicine as a duly certified doctor, attorney. I'm a member of the California Bar and the Ninth Circuit Court of Appeals, and I practice in Las Vegas primarily, although I have licenses in several states. I was riding my bike around the neighborhood after dark so I wouldn't get caught the other day with my dog. And I ran into a neighbor and I said, "How you doing?" And he said, "Oh, okay, my dad died last week." I said, "Oh, that's too bad." And I know his dad. And he said, "Yeah, we could only have 10 people at his service and 10 people at the funeral." And he said it, he was a little broken up when he said it, but how silly. There would have been a lot more than 10 people there, but that's all he could have. And he was certainly affected by the fact of these artificial guidelines that aren't really helping anybody with anything. I have a patient that went down to LA to get cancer surgery. He had a squamous cell carcinoma in his orbit. And the hospital he went to, he was lined up for surgery with 5 different surgeons in the OR. And the night before the surgery, the hospital called him up and said, "Well, we're not sure we can do your surgery because an administrator wants you to have a COVID test." So he called me and I said, "Well, let's see, we know you have cancer in your orbit, and who cares if you have COVID or not?" Anyway, things worked out. He got the procedure the next day, but there are other people. I'm aware of one person with a melanoma on her calf. The surgery was canceled, and you don't want to do that with melanoma. You know, the last few weeks when I've been on trauma call, when we'd show up at the hospital, they'd take our temperature and give us a mask, and we'd go do our thing in the hospital. And they were very dutiful about that, the nurses that were assigned to take the temperature. But I asked at both hospitals one day, "So how many COVIDs have you found trying to get in the hospital with an elevated temperature?" And both answers at both hospitals were 0. And one hospital I asked, I said, "So how many COVIDs do we have in here?" And they said, "Oh, probably less than 25, maybe 20. And I said, "Are all those confirmed?" And they said, "No, we just think some of them are COVID. Some of them are confirmed." And so the nurses understand too. And they know I'm a little bit irreverent sometimes. And I probably wouldn't be the best spokesman to try to convince people that this is not a big deal. But fortunately, the health professionals know that. I mean, most of the health professionals. 99% of the people that get this recover, and most of those never even knew they had it.